Hello, everybody, and welcome to today's program, Getting the Care You Need, Parkinson's in the Hospital. My name is Annie Long, and I am a Community Program Manager with the Parkinson's Foundation. All right, let's get started. Well, hopefully by now, you guys know a little bit about the Parkinson's Foundation, but we are the nation's leading community for people with Parkinson's disease, those who love them and those who are working to end the disease. I love this organization. My mom, actually, Allison, has Parkinson's disease, and I got involved with the organization back in 2013 after she was diagnosed. It has been our family's go-to resource for education, information, and support ever since. So a little bit about the Parkinson's Foundation and what we have to offer. As you guys can see on the screen, this is just a sampling of some of the resources that we provide to Parkinson's patients and families, including our educational book series. We have webinars, podcasts, a life-saving hospitalization kit, which we will actually talk about today, as well as a toll-free helpline, just to name a few. And our helpline staff, if you guys have never called our helpline, it's 1-800-4PD-INFO. Danielle will put that in the chat for you guys. It's a fantastic resource. So I encourage you to call our helpline staff with any questions that you might have, or if you need help with resources and support locally. All right, and I also hope that you've been able to see one of our PD Health at Home webinars. We actually at the Parkinson's Foundation, we're hosting PD Health at Home, Mindfulness Mondays, Wellness Wednesdays, and Fitness Fridays. So every single week you can actually tune in to hear new and fresh content from either an expert speaker. You can check out a fitness video, which we actually just released a new Fitness Fridays video today on our website from Total Health Works. If you guys are looking for exercise, we offer those resources for you. So to sign up for a PD Health at Home webinar, to check out our Fitness Fridays videos, or to meditate and reduce stress with a Mindfulness Monday, visit parkinson.org/pdhealth. All right, so I want to just briefly talk about a very exciting initiative that I would love all of you guys to explore and to hopefully get involved with. And this is our PD Generation initiative. The Parkinson's Foundation launched this in 2019, and it's basically free genetic testing and counseling for anybody living with Parkinson's disease. So this is very exciting, something the Parkinson's Foundation has invested a lot of time and money into. We want to help you get a better handle on what's going on with your genetics and how that relates to your diagnosis of Parkinson's, your treatment. PD Generation is also an initiative where you can be involved in helping inform researchers, right? So we're providing information on your genetics to researchers to hopefully better understand Parkinson's, better understand what we need to do to tailor treatment options and to really provide a better tomorrow for all of you. So definitely check out that website, parkinson.org/pdgeneration, for more information and to sign up and get started. There are not only in-person appointments, but you can now actually participate via telemedicine from the comfort of home, which is very exciting. So the Tennessee, Kentucky chapter, the Parkinson's Foundation is very excited to be able to reach local communities through our chapter network. We do have a Tennessee, Kentucky chapter that's hosting the program today. You can check out our website at parkinson.org/TNKY. There we'll post information about local events, support groups, exercise resources, and of course, community grant recipients in your area. So definitely visit our website and check us out on Facebook for more information. These are some of the upcoming educational events that we have as the Tennessee, Kentucky chapter. A really exciting one is a Veterans in Parkinson's program. If you or anybody you know is a veteran living with Parkinson's, or you're just curious and want more information about veterans specifically and how Parkinson's affects this community of people, you can join us on March 20th for our first VA and Parkinson's Foundation collaborative educational program. It's going to be very exciting. You can get more information at parkinson.org/SEVets. We're also doing a program on March 26th with the University of Tennessee in Knoxville. So Dr. Tollison is actually going to be presenting, and he's going to talk all about non-medication and complementary therapies. He'll talk a little bit about exercise and other things that you can be doing to complement your current treatment strategy for Parkinson's. All right, and of course we have our Moving Day walks for Parkinson's. If any of you have ever heard of Moving Day, it's a wonderful event for Parkinson's communities, their family members, and it's just a way for us as an organization to really bring communities together in the fight against Parkinson's, right? So these events are all about raising awareness and raising funds to support research and community programs. So as you can see, we have 3 events. One event, our Moving Day Nashville, is a fall program. So we'll be announcing the date for that later on this year. But we do have 2 virtual walks coming up, Moving Day Kentucky and Moving Day Knoxville. So we're very excited about those. You can visit those websites for more information. All right, and last but not least, I just want to be sure again that you write down our toll-free helpline number in case you haven't already done so. Keep this number handy. It's a great thing to put on your refrigerator, keep next to your bed. Our helpline specialists are wonderful. And of course, our website is parkinson.org. Again, this has been my go-to resource for information since my mom's diagnosis. Our website, it's very positive. It's informative, it's accurate. It's a very safe space for people with Parkinson's and their loved ones. So I want to thank our program sponsors today. These program sponsors are really, they really help us do what we do. They help us offer these programs, and they help the Parkinson's Foundation provide resources and support to all of you. So I want to thank Blue Cross Blue Shield of Tennessee for their support, as well as Kiowa Kirin. You can get more information about any of our program sponsors on our Tennessee Kentucky chapter site. We'll provide the link for you guys in the chat as well. Okay, so without further ado, I want to jump into the purpose of today's program, which is really for us to explore some of the challenges, unique challenges that people with Parkinson's face, whether you go to the hospital for a planned procedure or whether you have to go to the hospital for something unexpected. It's important for you to know how to best prepare, what tools and resources you need to have on hand, and what are some of the considerations? What are things that you and your families need to think through in order to be prepared? So I'm going to talk a little bit more broadly about challenges for people with Parkinson's, and then in just a few minutes, we're going to hear from Dr. Fenna Phibbs from Vanderbilt. She's going to talk more specifically about COVID-19, in the current climate. What do you really need to consider and think through to be prepared? All right, so again, today we're going to talk about some of the increased risks people with Parkinson's face in the hospital. We're also going to better understand, hopefully, the impact that COVID-19 has played on hospital stays. We'll learn about the hospitalization kit, better known as the Aware and Care Kit, through the Parkinson's Foundation. This is a fantastic tool that I hope all of you guys leave this program today. Either hopefully you already have it, but if you don't, we'll help you order one. Okay, so care transitions from hospital to home. So I think many people sort of assume that the hardest part of a hospitalization is transitioning from the hospital back home. But for people with Parkinson's, it's actually the opposite, right? The hardest part is actually going to the hospital and trying to navigate the system and trying to make sure that you're getting what you need when you need it. So many of us assume, maybe we did more so before COVID. I think obviously COVID has changed things a bit, but I would say prior to COVID, most of us, myself included, sort of, you assume the hospital is a safe place. If you get sick or if there's an emergency, that's probably the first place that you will think to go. You're going to probably think to yourself, the pharmacy is going to have my Parkinson's meds. They're going to have exactly what I need. It's a pharmacy, right? The staff, they're going to understand my Parkinson's symptoms, and they're not going to question me when I say, yeah, I need this or I'm feeling this way. It's a hospital. So of course I'm going to get exactly the treatment that I need, exactly when I need it. The reality is a little bit different, unfortunately, with Parkinson's. So one of the things that the Parkinson's Foundation has found over the years is that 3 out of 4 people with Parkinson's who are admitted to the hospital do not get their medications on time, or they do not get the correct medication, which with Parkinson's is a big deal. So this chart, I won't go into detail, but this kind of breaks it down for you. It gives you an example. So let's say 100 people with Parkinson's, there are 100 people with Parkinson's. Out of those 100, let's say on an annual basis, 33 of those 100 people go to the hospital, whether it's for something planned or unplanned. Of those 33 that go to the hospital, 25 of those people will either get their medication changed, meaning they'll get something that they're not taking, or they will not get their medication on time. And of those 25 people, 16 are going to suffer unnecessary complications as a result of medication changes. So the reality, so people with Parkinson's are hospitalized 44% more than their peers without Parkinson's. That's a big deal. And that's a really good reason that, that you guys should all order this Aware and Care kit that we'll get to in a moment. People with Parkinson's suffer avoidable complications at a higher rate than non-PD patients. Just as we talked about, a lot of this has to do with medication errors, getting contraindicated medications, and then of course not getting your meds when you need them. And then what do these complications mean for people with Parkinson's? Well, it can mean longer hospital stays. It can mean more problems, more complications. Lots of things can result from, unfortunately, from not getting your medications on time, not getting the right medications. So why is this happening? So even in the best hospitals, there can be a lack of understanding. Right now, especially with everything going on with COVID, even the best hospital staff can obviously have issues getting someone with Parkinson's their medications. This is very true. Many hospital pharmacies don't stock all Parkinson's medications. So for those of you, depending on what medication regimen you're on, the pharmacy at the hospital where you're having your procedure may not carry your meds. So again, we're going to kind of talk through all of these issues in a little bit more detail. So why is this happening? Why does there seem to be this disconnect? Well, 25% of hospitals, believe it or not, only 25 have a mechanism in place to contact a Parkinson's doctor upon admission. That number seems pretty low to me. I don't know about you. 70% of hospital staff are actually unaware of the drugs that can worsen Parkinson's symptoms or drugs that are contraindicated. I mean, a lot of the sort of commonly prescribed ER medications are actually contraindicated with Parkinson's. So you want to be really careful, and you want to be very well educated before you go to a hospital so that you can help educate your healthcare team. All right, and there's a lack of awareness, of the critical importance of Parkinson's medication timing. I mean, a lot of hospitals, obviously, they have nurses that make rounds and hand out medication, and they're doing the best that they can do. But sometimes their schedule doesn't align with your Parkinson's schedule. So that can cause some problems. And as I mentioned a moment ago, a lot of the common meds for things like pain and nausea, depression, and even psychosis are unsafe for you with Parkinson's. And hospitals are very complicated. I mean, you think about all of the providers that might interact with you in a hospital setting. Are they all talking to one another? Are they all familiar with Parkinson's? And then, of course, how you get to the hospital. If you are admitted to the hospital, if you call an ambulance, you might interact with a first responder. If you are admitted into the ER, it might be an ER nurse or an ER physician. So there could potentially be many hands on you, especially in an emergency setting. And you really have to think about how many of those hands know something about Parkinson's and know enough about Parkinson's to keep me safe. So challenges in Parkinson's care. Obviously, when you're admitted to the hospital, Parkinson's is often not the primary reason for being admitted. Could be an underlying condition. Again, it could be something unrelated altogether. So obviously your physicians are going to be looking at that primary reason for you being in the hospital, not necessarily talking to you about your Parkinson's. So you just want to be sure that you are as informed as you can be to, again, help your healthcare team help you. All right, and then of course, medication challenges. Many medications are used in the treatment of Parkinson's. You know, it's a good thing and a bad thing, you know, that there are so many treatment options available, but it can also get very complicated, you know, especially for a physician who's not familiar with Parkinson's. So it's really important, again, that you understand what medication you're on, and that you keep very detailed records and make sure that anybody in an ER setting or in a healthcare setting understands you and your unique needs. So this quote it's really powerful to me, but anti-Parkinson medications are as necessary to a Parkinson's patient as insulin is to a diabetic. That has always resonated with me, and hopefully it does with you and your healthcare team. But it's very important, as most of you probably know, that you get your Parkinson's meds. In addition to obviously the complications and complexities of having Parkinson's, the medication challenges, you guys in some cases are also dealing with some mobility challenges. So I know something Dr. Phibbs is going to talk through in just a moment is how important it is, if you guys do go to the hospital, if you are admitted for any reason, that you try to mobilize, you try to move as soon as you can and as often as you can. To try to prevent, you know, worsening of symptoms. You know, obviously you always want to move with the help of a care partner or a nurse, but make sure you're communicating, in addition to your medication needs, that you're communicating this need to have to mobilize to your nurses and healthcare staff. All right, so without further ado, I know we just kind of talked a little bit more generally about the challenges that you guys could face when being admitted to the hospital. Now, Dr. Phibbs is going to talk a little bit more specifically about COVID-19 and things that you and your family can do to sort of prepare and to try to be a little bit safer during this time. So I want to introduce Dr. Fenna Phibbs. I'm very excited that she was able to contribute this content for us today. So she's going to talk about how the COVID-19 pandemic has made it even more difficult for people with Parkinson's to get the care they need in the hospital, and what you and your loved ones can do to better prepare. Dr. Fenna Phibbs, for those of you guys who don't know, is the Associate Professor of Neurology at Vanderbilt University Medical Center. She specializes in movement disorders and deep brain stimulation, and she focuses on DBS and its applications in various movement disorders like Parkinson's, tremor, and dystonia. So Dr. Phibbs she's fantastic, and she's going to provide a lot of information. She does talk quickly, as I just did, so please know that we are recording today's program, and we'll provide you with the recording and the slides next week. So without further ado, we're going to kick it over to Dr. Fenna Phibbs.
Well, thank you for joining me today. I'm going to talk about the impact of COVID-19 and hospitalization on Parkinson's disease, a very timely topic. So first, I want to talk about the fact that Parkinson's disease itself does not seem to have any associated risks for COVID, meaning it doesn't increase your risk of catching COVID. And it's not really used as a risk factor as far as stratifying patients in that category. But Parkinson's patients are expected to have a higher risk for complications, despite having a normal immune system, since that's a lot of focus with COVID. In part due to being a disease of more mature individuals, mobility is impaired, and when your mobility is impaired, it's very difficult for you to maintain good muscle mass, also to have good lung function, because when you're up and walking, your lungs are much more open and engaged. Patients that are older are also more susceptible to pneumonia, which of course is a complication of COVID. And often with maturity comes additional diseases as well. And it's those comorbid or other associated disorders, diseases that can cause patients to have a harder time if they catch COVID. The effects of COVID has actually been studied. This is a study that was done in Italy that, if you remember way back almost a year ago, Italy was kind of a focus of the disease during the initial outbreak. And they looked at patients and compared them to age-matched controls to find out, how did their disease have bearing on their outcome. And also, what influence did COVID have on their disease? And a lot of you guys probably know this already, is that when you're sick, that your symptoms will act up. So here you see what they call the CSCI PD score, and that's a score of symptoms. And here showing that there's a greater disability. So my symptoms are not as well controlled. And then the UPDRS is the Parkinson's disease rating scale, showing that my motor function, my ability to get around, how well is my medicine working, such things like that are significantly affected. Also, other things are affected. I'm not feeling well, so therefore I don't sleep very well. I feel sick, and as we all know, my brain does not work well when I'm sick. Also, you can see more difficulties with bowel and bladder function as well. So this is stuff you know from being ill for other reasons, a bladder infection, but COVID certainly amplifies that as well. And what about the pandemic and the hidden sorrows? We know that Parkinson's patients are already under a significant amount of stress. You know, this disease is very socially isolating for people. It's hard to get out of your house. There's a burden of care that your patients, that your caregivers have as well. And we see that that's worsening with the pandemic. And this is certainly something that I see in clinic frequently. And the challenge is how do we keep people active? How do we keep people engaged socially during the pandemic? And that is very difficult. A lot of my patients were very actively exercising, but after the pandemic or during the pandemic, a lot of their exercise options are closed. Some people are doing rock steady boxing, which they can't go to now. Even personally, I'm struggling too because the gym that I go to is closed. That's on the campus for the students, but there are other gym options, but I don't feel comfortable going. So there are other options through the Parkinson's Foundation. They do have options to keep people active. There's the chair yoga. Some of the cable channels have fitness TV that you can do. Simply getting outside and walking. I saw the weather look out for the next couple of months. We're supposed to be above average, so no reason that you can't go outside and walk. But also looking at Zoom options. Some of the Rock City programs are actually doing things via Zoom and online. No, it's not the same, but it's something. We have to keep people moving and also get you interacting with other people as well. So what about the pandemic? So I was actually on our hospital service towards the end of December over the new year, and it was intense. As you see there, we had a significant peak in cases right around the end of December, correlating probably to the holidays. The last couple of weeks, things have actually gotten a little bit better as far as the number of cases. And this is information that I got off the Tennessee Department of Health, which actually is a really nice website. They make it very easy to navigate, to come up with numbers. You can look at by county as well. You see here as of yesterday, actually as of Thursday, there are over 4,000 new cases, 86 fatalities from it. And the last 14 days in the bottom right there, you see that we are trending a little bit better. There's always going to be some upshoots, and there's been other reasons for maybe some decreased testing and such, but it appears that we're maybe trending in a better direction, I hope. So what do you do if you suspect that you have COVID? This is a big difficulty. Anytime you have a headache or the sniffles or you cough, everybody stares at you and thinks, oh, geez, what do you have? Remember, call your primary care physician. Ask, how do I get tested? Some physicians' offices are able to test you. A lot of the counties are able to test you as well. So getting in contact and finding out, how do I get tested? Don't lie flat. You know, the concern there is not getting those lungs good and open. And as I mentioned earlier, the concern is lung function and development of pneumonia. So try and stay active. Fatigue is a big issue, but try to stay moving. And like I mentioned, expand your lungs as much as possible. Deep breath. With the voice therapy, you guys know voice volume is an issue. So practice yelling at each other. That can help a lot too. Maybe sing a little. And if you're having any concerning symptoms, shortness of breath, if you're having bluish discoloration of your lips or your hands, you're feeling really sleepy, maybe your caregiver is having a hard time getting you to wake up, or you're just more confused, that's a time to go to the ER. That's not a time to say, hey, maybe let's give it a little bit more time. The difficulty with oxygenation is oftentimes it's pretty low before you have symptoms, and that's a problem. So don't hesitate. Also, once you're in the hospital, request respiratory therapy. And again, the idea is engaging the lungs, keeping the lungs open and clear as much as you can. And also trying to keep you moving. In the hospital, they don't necessarily want you up and walking. Parkinson's patients, as I'll mention here in a little bit, do have a higher risk of falling, but getting physical therapy to help you where they can get you up and mobile and doing it safely. It is difficult though in the hospital now. Everybody's stretched really thin because everybody's having to cover additional patients. Vanderbilt's actually added extra beds to be able to cover our COVID patients. So some of these resources may be on the thinner side, but this is where you can engage nursing or potentially what they call care partners in the hospital to say, hey, can you walk with me if I want to get up and walk? So there's some great information resources too. I mentioned the Tennessee Department of Health is a great place to go. Vanderbilt also has really good information for COVID, both as far as what symptoms are going on, treatment options, where do I get the latest news, if I've been exposed to somebody, what do I do about that? So they're really good about keeping this information updated. And if you don't happen to come to Vanderbilt's hospital, other hospital systems have really good resources as well. Always check online. So what happens if you come to the hospital? What's it going to look like? What's it going to be? Emergencies, these have not changed. I can tell you when COVID first started back in the spring, I was also in the hospital that time. A lot of people ignored symptoms or tried to ignore them and didn't come when they should have. That's not a good thing. If you're having symptoms, please come see us. Abdominal pain, nausea, vomiting, diarrhea, where you can't keep hydrated. If you're having new neurologic symptoms, we know that COVID in some patients can cause strokes. If you're having difficulties breathing, chest pain, or pain that goes into the jaw or into the shoulder, concerning also for blood clot, but in that case, a heart attack. And then sometimes we still have to get other things taken care of. These aren't necessarily emergent procedures, but these are things that, I need to do these. I need to do these for improvement quality of life. Your facility will talk with you about what has to happen. For example, at Vanderbilt, patients are tested for COVID within 48 hours of their procedure, and they'll talk with you about how to stay safe. Also, most facilities have COVID patients isolated. So some patients have said, I don't want to go to the ER, or I don't want to go in because I don't want to be exposed to COVID. They're doing a really good job about keeping those patients separate. So at Vanderbilt, we actually have a separate assessment area in the parking garage that's been converted to hospital space, where anybody that has any concerning symptoms for potential COVID are actually sent there and not seen in the ER. And they also do a good job if somebody's in the ER for another reason, but has symptoms that maybe that is, they actually put them in isolation, keep track of who goes in and out of that room. And the other reason why we test people for procedures is to make sure that people are not being exposed. And remember, everybody that works there goes through daily screening. So that way, if we have any symptoms, we won't be there spreading our potential COVID to other people as well. Other reasons why sometimes people get infusions or dialysis as well. And those facilities have also taken things very seriously and are doing a good job with masking and social distancing and stuff like that. And I mentioned earlier, we are seeing that there's delays in care for people because of concerns for COVID. I think this is getting better, but remember, an emergency is still an emergency. And we even actually canceled all elective surgeries there in the spring and realized that, even though it may not be an emergent surgery, things are still important to get done from a health standpoint. So we realize this too, and are trying to be selective about cases that we potentially have to cancel to try and keep room in the hospital to take care of COVID patients. So considerations for hospitalization. This is a very difficult time for patients. And you may not have your care partner with you. And that's difficult because they may be somebody that helps you with your medications, make sure that you're taking them on time. And it can be lonely if you don't have them with you. Parkinson's patients that are higher risk for developing delirium. So delirium is where you get confused. Hospitals never stop. They run 24 hours. The lights are always on. There's always activity. And that can be disorienting for people, and that can cause delirium. This is not something that's unusual in the hospital. We actually see it really frequently. And Parkinson's patients are a little bit higher risk for this. And having somebody there that you know can help with this, and they can orient you. But if you're not able to have them with you, the risk is higher. And here you see that one thing that we can help is we try to do things like turn the lights off, try and mitigate noise, but that's challenging. We also have to be careful with medications that we give, but always having family members in the hospital can be really helpful, as we note here. And if you can't come in, a phone call, have the phone with you. You can do FaceTime, stuff like that. So you get that familiarity with you. Um, this is a challenge. And even at Vanderbilt, we struggle that not everybody's educated about Parkinson's disease. We actually have a project going on where we're trying to get teams and other hospital services familiar with Parkinson's disease and letting them understand the importance of getting medications on time and about dosing. The challenge is if we say somebody's taking something 3 times a day, for you guys, that's usually, breakfast, lunch, dinner. But according to the hospital, that's every 8 hours, which is vastly different than how you take your medicines. So it's important that you do the education for yourself to educate your nursing staff and your physicians to say, hey, this is important. This is why I need to get my medicine on time. And bringing your bottles with you is very important. The challenge too is our nurses are very busy. Also now because of COVID, we're actually getting patients taken care of by nurses that aren't familiar with this particular area because we're having to pull nurses to the COVID unit. We have folks that are working on our floors that aren't primarily neuro nurses and aren't used to taking care of patients like this. And so they're also taking care of more patients. So even though your medication says it's supposed to be delivered at 8, noon, and 5, they have plus or minus an hour within that window to actually give your medication. So that makes it even more difficult to keep up. And not to mention shift change. Nurses have to go home eventually. They work very long 12-hour shifts, and we try to make the handoffs as thorough as we can. But sometimes things, are missed, especially if something's happening right around shift change. Information is difficult to hand off. So, yes. You repeat your story frequently, and educating folks when they come in to meet you for the first time is very, very important. We also have a challenge with the fact that we can't carry every medication. So there are medications that you may be on that the hospital does not carry. And it's helpful that if you have a planned hospitalization to talk with that physician, say you're going in for surgery, you can talk with that physician about your medications and talk about, hey, is this stuff you guys carry? Is it not? If the hospitalization is more emergent, talking with the nursing staff. Some hospitals even have a pharmacist that works on the floor and can talk with you about medications. There are medications we can often switch out, like if you're on Stalevo, for example. Vanderbilt doesn't carry that, but we do cover the ingredients of that, of carbidopa, levodopa, and Comtan, which we can give you. So there are some substitutions that we can do. The other difficulty is, what if you don't get your care at the hospital that you're at? If you come in emergently through an ambulance, sometimes you don't get to go to the hospital that you want. So maybe you're going to a place that your neurologist doesn't actually work at. And so that can be a difficulty as well, is having them be able to see what you're taking, what you've tried before. And it's important to try and get everybody on the same page. Also researching what the visitor policy is. So if you have a planned hospitalization or a planned procedure, knowing who can I bring with me? What's that going to look like? You can talk with the nurses or the folks that are setting up your procedure. Or if I have a loved one that's there, I need to look up visitor policies. And be able to educate your team. Like I mentioned earlier, it's hard to know everything for physicians and for nurses. So educating them and bringing these materials that you guys will learn about can be very, very helpful. Bring your bottles. Even though you say, I take it 3 times a day, or I take it at these times, they need to see the bottles. Also, make sure the bottles are accurate. Sometimes we just dump a new prescription into the old bottle and don't actually have the details of the new updated prescription. So make sure they're the new bottles that have the correct dosing on them. Also make sure that you come in with information of ways of getting a hold of your loved ones or the person that would maybe making your decisions if you were unable to. So have that contact list available. It's very, very helpful. Bring your phone and The charger. Make sure that you got that with you. The nurses do a great job about loaning chargers to patients and stuff like that. But the last thing we want to see is the phone go dead and not being able to have access to your family and loved ones. And I mentioned earlier about FaceTiming and stuff like that. We know how important that is. And some floors actually have iPads that they can loan to patients so you can FaceTime with family. But if you can do it with your phone, it's a lot easier. If possible, trying to go to the hospital that your neurologist is at. Again, I mentioned sometimes we don't have that choice, but it's often better if you can. Even though the neurologist may not be able to come see you in the hospital, they at least have co-workers that would be able to touch base with your neurologist and then come and see if needed. Um, if you know that you have a planned procedure, talking with your neurologist ahead of time. I've had patients ask me that, like, hey, can you make a list of medications that I shouldn't take? Because that way, maybe you can give that to your family member that's with you, and then they can talk with the nurses about stuff that you're getting. Or, what would I expect? And that way you can engage the neurologist's thoughts too, because they may have some personal experience with the hospital, or maybe even know the physician that's going to be taking care of you while you're there. Um, Also making sure the neurologist knows that you're actually in the hospital. We try to let other people know that, hey, one of your patients is in the hospital. Sometimes that's difficult, but making them aware, also letting the team of doctors know, hey, if you guys have questions about my Parkinson's or my medicine, here's my physician's phone number. We can't, as a physician, reach out to that team, but your team can call us and talk to us. So having a way to contact us is very, very important. It actually doesn't happen all that often, but I've had some great phone calls with physicians really trying to improve care for patients. So make sure they have that way of contacting us. So I mentioned earlier about the visitors policy. This is rapidly changing. As you see here, this one was updated on the 13th of this year. And it talks about the fact you'll be screened. How can who can go, where can I actually go? And it's just worthwhile checking before you head there. And every unit is sometimes different. Like labor and delivery has a little bit of a different rule than other wings of the hospital do as well. And you can see COVID positive patients. There is just particular times and ways that can happen. So look this up ahead of time, and that can be really, really helpful. That way you kind of know what's going to happen. Now, there are certainly reasons why you may be allowed to have more than one visitor. If something's particularly life-threatening, sometimes we'll have ways of getting more people in. But that's also where talking with the nursing staff and the physicians about, hey, can we potentially have more people in? We used to round, actually, when Vanderbilt didn't have any visitors allowed, we actually would get a hold of the family through FaceTime or something like that on the phone to be able to have them participate in our daily roundings. That way everybody knew what our plan was for the day for the patient. So what about actually at the hospital? So, insist, can I please have somebody that can stay? Sometimes people are actually allowed to stay overnight, and that can actually be very beneficial for nursing staff as well, because you can assist things like getting a drink of water, reminding them, the patient, hey, you shouldn't get up. I don't want you to fall. We occasionally even allow a care partner to be able to give medications. This is, again, is something where you can talk to your physicians ahead of time to say, hey, look, maybe this is a medicine that the hospital doesn't carry. It's important that they get this medicine. And the nurses will talk with you about how to do that. Sometimes the bottles are stored someplace else where they're under lock and key, but then the care partner can, hey, can I help give it? So there's things that can happen. Don't be frustrated if it doesn't, but it's helpful to ask these things. Bring material with you about your disease, about your dosing. That can be very helpful as well. And you'll be surprised that you can teach a lot. There's a reason why Vanderbilt has a lot of medical students working on our floors, because you guys are our best teachers. And bringing education material is not a way to talk down to people. It's a way to say, this is how you can take better care of me. And that's our goal. And again, like we mentioned, contacting a neurologist if the team has any questions. And then any changes to your Parkinson's medicine, really say, can you please talk with my neurologist about that? There are medications that we use for your disease that may interact with other medications that the team wants to use, or they may want to make changes that, let's try this instead. And that can be very helpful to have that discussion as well. And then, like we mentioned, trying to say, hey, can physical therapy come see me earlier? I want to get up and move. It doesn't take long to get weak, just a couple of days of laying in bed. So we want to get you moving as much as we can. And then also, if things aren't going well, reaching out to other people, talking with maybe the charge nurse on the floor, talking with patient relations when you feel like, things aren't going well here. And it's a good way to get everybody that's involved in the care to kind of get on the same page. And it helps us realize maybe we're not communicating well, maybe we're not doing this well. And there's avenues to be able to do that for you. And I want to talk one last thing about vaccines, which is a rapidly evolving thing, given the fact it's only been out for about 6 to 8 weeks. There's a lot of ways to get information. The Tennessee Department of Health has a great website for that. Your county's health department also would have a good way to find out more information. And through Vanderbilt, we have a website for that, but also through My Health at Vanderbilt. If you happen to be seen with us, they will contact you through My Health at Vanderbilt when you qualify to get the vaccine. And it's not necessarily always occurring at Vanderbilt, but they'll let you know when, based off their criteria, you are able to get the vaccine. And there's many ways to do that. I often tell patients, get on as many lists as you can. That way we can get it to you as soon as we can. We are encouraging people to get the vaccine. There's no evidence that because of Parkinson's disease, you won't do as well with the vaccine. Remember, the goal is to keep you as healthy as we can to try and avoid worsening symptoms. So that is all I have. Thank you for listening to me today. I appreciate it.
Well, that was very informative. A huge thanks to Dr. Phibbs for all the information she provided. And I know she did touch on the just regarding the COVID vaccine. If you haven't already, our Parkinson's Foundation website has a lot of very good, relevant, up-to-date coronavirus information, including a Facebook Live event that our National Medical Director did entirely on the COVID-19 vaccine. So definitely visit our website. Danielle, I know, can put that information in the chat so that you can check it out after today's program if you still have questions. Again, you can also call our helpline or contact your county's health department as well. So again, thanks to Dr. Phibbs. I want to introduce our final speaker, Stan Jones, who is a Parkinson's Foundation Aware and Care Ambassador. After his father-in-law was diagnosed with Parkinson's about 7 years ago, Stan and his wife, Rebecca, relocated from California to Nashville, and Stan found that the local support team was just amazing, and it has inspired him to get involved with the Parkinson's Foundation as a volunteer. So Stan, without further ado, take it away.
Okay, great. Can you see my material?
Not yet, Stan. You can share your screen now.
Okay. Oops. There we go. Whoops, sorry. I'm sorry, technical difficulties. There we go. And hopefully that's it.
Yep, that's it, Stan. That looks good.
Perfect. All right. Well, thank you very much, Annie. Great information from both you and Dr. Phibbs. Lots of challenges. So just to make a challenging time even more challenging. So what I'm going to talk through today is a tool that's been developed to help you address those challenges and better communicate with the team that you're going to be working with. So in doing that, the Parkinson's Foundation put together a program called Aware and Care Ambassadors. It's basically a group of people that has gone through training about the Aware and Care kit, and takes time to talk with folks in the community, caregivers, people with PD, clinicians, the hardworking doctors and nurses, and first responders to distribute and explain this information. So the kit can be used both for planned and unplanned visits. And again, it's just a tool for facilitating communication, but it's a valuable tool. And like any tool, if you don't use it, it doesn't work. So basically, looks like this in person. The kit itself is a good place to carry all of the information we're going to go through in detail, as well as your medication and any other piece of information that you would like to carry. I recommend that you have this in a place where it is easy to find, maybe close to the door, so you don't have to go looking for it. So we're going to talk about what's specifically in the kit today, and then how do I get the kit? So let's start off with how do I get it? There's 3 different ways to do this. You can go to parkinson.org/awareandcare, and you don't need to worry about the capitals. If you get the kit, you can order it online. The kit is free. However, there's $8 in postage, but it's sent directly to you, and it will have everything that we're going to talk about today. Another option for you is to either order online just the paper content and have that mailed to you. That is free. There's no shipping charge there. You can also call the helpline, and at the end of the presentation, we'll give this contact info to you again, along with the phone number. And then another option for you is just to go to the site, and you can access all of the printable material there and print it out on your own computer. So let's start with the medical alert card. So this is going to be something, you see the front and back of it there on the screen. This is what it's going to look like. It folds up, goes in your wallet. This is going to be something that's going to be very valuable for first responders. This is a distillation of a lot of the information that you heard from Annie and Dr. Phibbs, just basically saying, hey, be careful about these medications. These are contraindicated. These are things that people need to be aware of right off the bat. And in the kit itself, there's also a bracelet. It says it's hypoallergenic and waterproof, and it's also turquoise. But what it's going to tell you, or tell the first responder, is, hey, look in the wallet to see the card, because that may not be the first place that people go. It also has a very pertinent notification on here that says, hey, I have Parkinson's. I'm not intoxicated. You can imagine that the first responders, a lot of the people that they encounter are under the influence of substances and may have motion disorders or speech disorders, which could be misinterpreted in the case of somebody with Parkinson's. So the fact sheet for nurses, when you order the kit or the packet, you'll get a package or a pad of these. I will date myself here and say that I look at this like Cliff's Notes for nurses, but take multiple sheets with you. It will go through, again, contraindicated medications, critical care considerations, common symptoms, and special alerts on here. So remember, I think as Dr. Phibbs said, you're going to be in the hospital. You're going to have multiple shifts of people coming through. Have multiple pages of this so that every time that you talk with the care team, that you're able to share with them this information. Okay, medication form. This is a very important one as well. Again, you see both the front and back there is what it looks like in person. This will give information about yourself, your care partner, your neurologist, your primary physician, your pharmacy, any other conditions that you might have. And then, of course, the important part, what medications are you currently taking? What's your dosage and the frequency and timing? And then on the back, any considerations, do you have a DBS device, a dual pump, trouble swallowing, things of that nature. So this is also something that you can have the pad and fill it out by hand, but you can also go online, fill it out online and print it out from there. If your handwriting is anything like mine, I would recommend typing it out or typing it in and printing it out. So another important piece of information for communication. This is a letter to the physician that you can review beforehand on a planned visit or bring with you. Again, talks through a lot of the things that we've been talking about, things that are contraindicated, potential impacts of symptoms, making sure that you're adhering to the schedule, and then also highlighted down at the bottom is if there are proposed changes in medication that they should reach out and talk to the doctor, and then the doctor's information there is at the bottom. Um, Dr. Phibbs talked about COVID-19 and having discussions around options if there are restrictions there at the care facility. All right. Next piece is the hospital action plan. So this is also available for download and print, comes in the Aware and Care kit. It doesn't come with the Aware and Care packet, but it goes through a lot of the recommendations that Dr. Phibbs talked about, and we'll just briefly go through these, not to totally repeat everything that she said, but prepare your information beforehand, have it with you, take it with you, use it. You probably already have a hospital that you interact with, but get to know the people there, get to just have a plan for getting there. It's like having a fire awareness or response in your home. Nobody really wants to go to the hospital, but if you have a plan, you're going to be much better off. She talked a lot about being vocal. You can always be vocal in a nice way, get to know the people there. First name basis, it's great so that they understand you, they understand the issues that you're dealing with. She was very clear about bringing the medications in the original bottle and also in the up-to-date bottle. Let them know if you're having problems. There's usually a patient advocate that you can reach out to. Moving is very, very important with almost every procedure, whether it's heart surgery, knee replacement, whatever. They're wanting to get you up and get you around. So if you're also having any difficulties there, you can reach out to the occupational therapist, physical therapist, or other therapists that they're available. So Annie talked in the beginning about, making assumptions about what happens when you're in the hospital and you think, oh, well, they're just going to take care of that. You need to stay on top of what's going on. There's a notebook in the kit that you can take notes and keep track of what's going on. But again, being in contact, communicating is going to deliver a much, much better result. And then after you leave the hospital, You want to reach out and contact your normal Parkinson's doctor, probably review your discharge orders with them, talk about follow-up care, things that you need to do for your recovery, and then also to continue and maybe even make any updates that would be needed for your Parkinson's care. So just to summarize, you can use the kit for either a planned stay, an emergency visit. Make sure that your care team is aware of the information, knows what's in it, working with you to keep it updated. Bring it with you when you're going to your normal Parkinson's doctor, review the contents with them, make sure that everything is correct and updated. Very important to keep it with you or bring it with you when you're traveling. Bringing extra medication, you can split up and have extra medication in your suitcase, one in your carry-on bag, but always where you have medication that's right where you need it. And then also, hopefully that you would run into extreme weather problems, but that's also going to be an issue. Excuse me, my printer just went off. So the perils of Zoom meetings. But having this at hand and ready, should there be hurricane, tornado, whatever, making sure that you've always got this information at hand. Again, very important for first responders. So Annie talked about some of the additional material that's available on the website. So again, parkinsons.org/aware and care. There are other webinars. There are support group discussion guides. This is where you're going to order the kit. But again, be active in the use of these materials, and it will help you optimize any experience. So here's the other contact information, the 1-800-4PD-INFO. You can, if you're uncomfortable with the computer side of things, you can always call the helpline is great, and they can get all the information that we've talked about. So once again, to recognize the folks that make all of this possible. This is how or why the kit is free, through the contributions of these folks. And then today's program specifically sponsored or by Blue Cross Blue Shield of Tennessee and Kyowa Kirin. So shout out to them. If you'd like to learn more about them as well, here's the website here, parkinson.org/TKNY/chapters-supporters. So with that, thanks very much for joining. Hope this was helpful.
Thank you so much, Stan. That was fantastic. I know all about the Zoom hurdles that can happen. My little pug is in the bathroom. So thanks to all of you guys so much for joining us today. I hope this information was helpful. As Stan mentioned, I want to thank our program sponsors, Blue Cross Blue Shield of Tennessee and Kyowa Kirin for their support, as well as our Aware and Care Initiative supporters. I want to thank Dr. Phibbs. I want to thank Stan. Stan, it's amazing what you're doing, especially as a volunteer. So thank you for the commitment that you're making to help get this information into the hands of people who need it. So I guess the bad news is that, people with Parkinson's may have additional challenges, in the hospital. The good news is that the Parkinson's Foundation, Aware and Care ambassadors like Stan are helping to address those challenges by providing Aware and Care kit information, making sure that you guys know exactly how to prepare for the unexpected. Great points about traveling as well. I know we talked a lot about hospital safety, but I think it's important for us to always be prepared. And this kit is a great place to start. So definitely order one if you have not already done so. I also want to remind you guys that the Parkinson's Foundation is hosting PD Health at Home programs Mondays, Wednesdays, and Fridays. So again, please check out next week's lineup. Krista does a fabulous job with Mindfulness Mondays. So definitely join her on Monday to meditate and reduce stress. It's a nice way to start your day. You can get the information at parkinson.org/pdhealth. Today's program was recorded, as I mentioned before, so we'll be sending out that recording via email sometime next week. I know this is a lot of information, so we're excited to be able to provide it to you as a recording as well. We will also send out slides. So again, lots of good information packed on the slides that we'll follow up. We'll follow up in an email with all of that. So if there were questions that you had that were not addressed today, please call our toll-free helpline at 1-800-4PD-INFO. They are a wonderful resource and available to address any of your questions, provide referrals. And I just, with that, want to thank all of you again for joining us today, and Danielle for your Zoom support. So thanks to everybody, and enjoy the weekend and stay safe. Bye, everyone.